We all have one, the person that became our best friend from the start, the one we grew up with, took road trips with, and told secrets to. The one that stood up at each other's weddings and cried together tears of joy when children were born, and cried together tears of sadness when loved ones were lost. Someone you expect to grow old with. For me, that one is Janet. Near or far for the last 42 years, we've been more than besties. We've been sisters. We balance each other. She is quiet and shy and laid back. Me, not so much. A year ago, I was blindsided when she suddenly became seriously ill. What we were told was a stubborn case of pneumonia, with stage 4 lung cancer and stage 2 lymphoma. With great sorrow, I watched my best friend, now weighing 92 pounds, lay dying. For the first time in our lives, there was nothing I could do to help her. I would sit at her hospital bed for hours and hours, just holding her hand, afraid if I left, I'd never see her again. As I was sitting by her hospital bed, I noticed the orders on the whiteboard. It said, "Take partials out and clean." I had to read that again. I could not understand why they were concerned about her partials, which she did not have, but not concerned about her teeth, which she did have. I pulled back Janet's lips. What I saw was shocking. Who in this intensive care unit was providing her oral care? Obviously, no one. I know the oral systemic link, and I found something I could do to help her. From that moment on, I provided her oral care myself. I am not insinuating that caregivers or facilities are negligent. Caregivers have multiple patients to take care of, and time is scarce. Most healthcare providers and healthcare workers have never received any formal education on the oral systemic link or how to determine and provide proper oral care for each patient. Our population is growing and living longer, and the need for care facilities has exploded. Resources such as qualified staffing, proper training, adequate patient time, and funding are all in short supply. We are healthcare professionals, and we must change this, not only because it affects the quality of life for our patients, but because these facilities depend on funding from a variety of sources, all of which are determined on patient outcome and length of stay. Even online reviews and health grades impact how a facility is run. The oral systemic link is real, and lack of oral care is a main contributor not only to minor infections such as sinus or ear, but serious diseases, cardiac disease, stroke, cancer, Alzheimer's, diabetes, many more. Neglect of these conditions can have life-changing consequences and cause death for any of us, but especially those that depend on others for their care. Mother Theresa said, "It's not how much you do, it's how much love you put into the doing that matters." What started as my mission to care for Janet has become my mission to care for others. In my presentation, I share with you how we can come together not only to provide optimal patient care, but to improve the quality of life for our patients. First, we must educate. The vast majority of healthcare professionals have not taken the time necessary to educate themselves on the oral systemic link. It is not just a catchphrase, it is a healthcare crisis, and we cannot adequately educate others unless we ourselves have a full grasp of its scope and severity. Secondly, we must engage. Engaging in our communities is crucial. We have to reach out and form partnerships, not only with our medical peers, but with nursing homes, assisted living facilities, long-term care facilities, in-home health agencies, schools, veteran services, homeless shelters. There are so many that need our help. Organizing a community event is the fastest way to get this life-saving information to a large group of people and also spread goodwill. Last, we must empower. Through education and engagement, we are empowering our patients, their caregivers, and the community to be more proactive. Armed with the information that they need to understand the oral systemic link and the tools that they can use to work within their personal challenges and limitations will give them the best result. A person that can improve their oral health will see an improvement in their physical health as well, and will not only feel better, but could save some money on things like doctor's visits or medications. We are the professionals. We have a moral and ethical obligation to spread this information and give the gift of life. There is no excuse. You might be wondering how Janet's doing. We were able to get her transferred to Stanford University Medical Center, and she underwent extensive treatment. And by the grace of God, she's in remission. Yeah. She's feeling wonderful, she's looking beautiful, anticipating the birth of a new grandbaby, and, like most women do, complaining about her muffin top. Thank you.